So this is David, and he's been working with me for a couple weeks now. He was scheduled for shoulder surgery, and he elected now not to do it because he's feeling better. I'm going to let him just talk a little bit about what we went through so far.
So years of abuse from swimming and polishing cars. I'm in the automotive business. I tore the rotor cuffs in both shoulders. Was scheduled for the first surgery here in 2 weeks, and after 3 weeks of working with Zach, I've decided I'm too strong to go through the surgery, and if I continue on this progress, I don't think I'll ever need to do it.
Sounds like a great testimonial. So now what we're going to do is we're going to go in. I'm going to show you how I adjusted some of the exercises that we use in the system. It really comes down to 4 different exercises that we use on him. I'm also going to talk about the muscles that were very weak on him, so we're going to go into that now. And keep in mind, if you're dealing with a nagging shoulder injury, it's going to be best to work with me one-on-one so we can adjust everything and make everything perfect for you so you can get out of pain in 6 to 8 weeks. So with this exercise here, you see this strip? Okay, that's what we're working right here. With the second exercise, you're going to see it's a lower section of the rear delt right here. This one is right above that, and this is what our main concentration is. So we're trying to develop this piece. It's got all, see how there's barely any development there in that muscle, a tiny little bit. But this is why the shoulder's bothering him. So this is the thumb down raise, okay? There's a couple different levels to this, but notice how for him, if he comes up, the higher he comes up, look, he doesn't have, this won't relax, so he's getting a lot more trapped. See how he can drop it down now? But if he tries to stay in this position here, generally what happens, he'll shrug up. So what we gotta do is we gotta start around hip level. If this is straight up and down, he's going to turn his hand just a little bit. Now he's moving on that plane just like that. Okay, the bench is 1 notch below 45. He puts his leg here, and he's trying to open his chest up a little bit that way so he can stay on this angle just like that. And that's always moving. See how now his shoulder's down, he's not using any trap, and it's a very short range from here to here. So that's how we started with him so he could develop that back of the shoulder muscle that we just showed you. And as he gets better, we're going to start having him climb more up above the belly button, kind of center of the stomach, and then he moves up in here. And then this right here, that's your delt back or your pants pull muscle is there. That fire in here, that piece of the delt. So you see, we're trying to develop that there, and you see how nothing really, that piece doesn't really pop out. See that? And back. We're going to take this elbow, we're going to push it out, and he's going to touch the bottom, okay, of this pocket here. If you get too high up, then he's going to use his trap. So right here, touch the bottom of the pocket, push the elbow forward so this shoulder rolls forward here. Now I'm going to explain why we roll the shoulder forward in a minute, but let's just get into the technique. So this stays down, this is out, and then he's just going to move a couple inches down and then back to that pocket line. That's all he's doing. And we're working that muscle that we just showed you right here. And this is actually really starting to form on him nice. You can feel it. This bottom section here of the rear delt. That's that upper piece there that he worked with a thumb down raise. We're right here, the bottom section. That looks awesome. The shoulder rolls back. Where do you feel it more? Down through here, correct? More into there? Yeah. So then he starts feeling it more into his trap. Okay? Now that's taking away from developing this piece. So that's why we got to push the elbow forward, and that gets the shoulder to roll forward. And now he can isolate it in here. If he goes back with his elbow, bam, he's going to start getting more into the trap and take away from that lower section. And in the app, once you get good at this, you pass a certain weight load, then you move on to a totally different exercise. It's called the pants pulls. You've seen that in some other videos, but this is a way better start point. And then even after the pants pulls, we have another advancement after that, so you can really start connecting and building into this muscle as much as you can. And then this right here, that's your delt back or your pants pull muscle is there. Teres is right there. That's actually his teres muscles, but see how his scap is pushing out, so you can see how there's very minimal development there in the teres. That's what's causing the shoulder pain. What he's basically doing is we're at 45 degrees here with his body this way. He's just sitting. You can do this kneeling. And then his arm, when he pulls down here, it's going to be very vertical, straight up and down. And he's going to hold, and I'm not going to let him, from there, he's going to push that shoulder down, there. When we downward depress, Now we can get the teres really firing and working through there, okay? And that's that muscle that I showed you before. So I have that gap, and then he pushes down, and now I can really get into this muscle here. But again, the forearm is very vertical. His body's angled this way, and his forearm's this way, just like this. He's not going behind himself. He's going more in front with his body at a 45-degree angle. And again, all this is in the app, and we have 3 or 4 different progression exercises that you move on to after you master this one here. But this one takes a couple months to really get in and develop this muscle here. And if you try to go too fast through the stages, then you miss this piece and you're done.
It's just amazing how much better it feels, how much stronger I feel in only 3 weeks. It's remarkable.
And so you started to feel that muscle firing, like you had a little bit of the muscle working when we first started, but now you can actually use it.
I can actually feel the muscle there. And when I'm doing day-to-day operations, I do tree work and pulling on a rope, I can lock in with that muscle and actually use it instead of rolling my shoulder over and feeling where I had torn it.
So if here's the back of your delt right here, we're gonna feel that behind, like here's your armpit right here, this little triangle section right through here. This is just your basic PT rotator cuff exercise. So we're just feeling it right back in that spot that we told you. If he feels anything in the front, he's not ready for this exercise. We didn't start with this. I had to get his delts built up a little bit more, because when you first did it, it would go all into the front, right? You had to really watch it.
Yeah, and when I was in the regular PT, this was the only exercise.
And it didn't really do anything, correct?
Well, I mean, it helped a little, but because there was none of the other work, I didn't have any gains.
There you go. So
this was the only exercise out of the 4.
And look at 2, he's not out here. He's slightly inside the elbow. He's not putting any pressure down, and he's just coming up. If it, go drop it down. If he feels pressure real low, then he only goes to there. If he feels pressure in the front and he goes up to here, then he just goes within that zone. As he gets better, the range will go up and the range will go down. And when he started, he literally was like this. Okay, and now 3 weeks later, go ahead and just show them your range that you got with no pain in the front of the shoulder. We're looking for no pain in the front.
No pressure.
Right.
All in the back.